appreciate Americans for Prosperity Illinois putting these forums together around the state and just being a great advocate for policy thinking and solutions to some of the intractable public policy challenges that the state and this nation faces. Doing a great job arming people with information so you can be opinion leaders within your circles of influence. So it's a pleasure to be here. I am not a practitioner in the healthcare arena like Dr. Neerhoff and Mr. Tucker. I am rather into one of these for a living. Words are my business, and as a great man once said, words are the currency of politics. That great man was me. And I think what I meant by that was that we should be very careful in choosing our words. And we have a negative composite example of this from the left. I should have greeted you all this afternoon. Good afternoon, freeloaders. Because that's what President Obama called you last week in Toledo when he was asked about Obamacare. People need to pay, people need to purchase, because we can't have freeloaders in the system. Now the people that don't pay, the 47% that Mr. Tucker spoke about, those apparently are not freeloaders, so that is upside down. But this again is the administration that brought us the aphorism that we need to keep spending money lest we go bankrupt. This is the administration that brought you this healthcare legislation that we're talking about called the Patient Protection and Affordability Care Act. These are contradictions in terms, and what they're doing is something that we all should be very, very familiar with in this state, because they've been running these scams and these rhetorical artifices on us for decades upon decades. In the city of Chicago, from where I hail currently, centuries, it seems like. And that is hoping that you won't engage and provide the rhetorical anecdote to their scams. The decision, the Supreme Court decision, Justice Roberts' opinion, you can kind of synthesize it, at least this is my synthesis of it. What he essentially argued in upholding the individual mandate is that the federal government's power to regulate is not unlimited, but the federal government's power to tax and spend is unlimited. The problem with that, again, speaking of contradictions in terms, is that if the power to tax and spend is unlimited, then by definition so is the power to regulate. Because taxation drives behavior. People respond to incentives. This should not be revelatory. And so if I'm going to determine people's behavior, if I'm going to constrict their options through public sector spending, which crowds out private sector investment, then I'm essentially regulating their conduct in an unlimited fashion. And that's really changing the nature of the relationship, the power relationship between government and citizen, expanding the government at the expense of the citizen, because that truly is a zero-sum game. The good news is that despite all of the superficial words and misdirection plays and hundreds of millions of dollars in advertisement and countless primetime television speeches and the Supreme Court decision, the left, President Obama, has lost the argument. Because thankfully 6 to 7 in 10 Americans still have their heads screwed on straight and reject categorically Obamacare. They still want to see it overturned, which is why the president and left-leaning members of Congress don't want to talk about it. Usually when you achieve victory, that's something that you want to celebrate and shout about, and you want to discuss in detail. How did you do it? How did you put together the coalition? What is the positive that is going to come from this? And yet, when they're asked about this on the campaign trail, and that's the only way the issue ever even comes up, if it's prompted, they are quiet as church mice, because they recognize the numbers that I just referenced, which is they're on the opposite side of popular opinion, because people intuitively understand just what an abridgment of our God-given liberties this legislation is, just how transformational it would be were it allowed to stand in terms of how we interact as human beings with one another in what has been, up until this point, for 236 years, a free society. So the opportunity there is if they don't want to talk about it, that probably means opponents should be talking about it.
Right.
Because in 2010, the 2010 election in which Republicans took control of the House and made progress in the Senate was really a referendum on Obamacare. I mean, kind of the umbrella was spending, but the specific was Obamacare. And if we, center-right thinking people, freedom-loving people, force this conversation again in the next 4 months and make 2012 a referendum on Obamacare, we can achieve our policy goal, which is to rescind Obamacare. But you cannot repeal or get rid of Obamacare without first getting rid of Obama. And so elections matter, and that is the first order of business now that the Supreme Court has spoken. Thinking about the Roberts decision too, so there's two things that are transformational about it. One, of course, is, and Mr. Tucker and Dr. Neerhoff kind of mentioned this as well, but it forces you into stream of commerce. It forces you to purchase things. And it tells you how you're going to spend your money and on what and how much. It's funny, Steve Forbes, the publisher of Forbes magazine, of course, said, he had a great observation about this that is elegant in its simplicity. He said, I think about this. In business, if you have increased demand for your good or service, that is a good thing. That is a positive occurrence. In healthcare, when we have increased demand for healthcare services, it's called a crisis. Why is that? Well, because government's in charge of it. Now, this is a backdoor takeover of government takeover of healthcare, but even prior to Obamacare, government was the largest purchaser of healthcare in this country. And by the way, if we want to think about kind of models that have been scaled and what they tell us in terms of cautionary tales about Obamacare, think about Medicare. Medicare was passed in 1966. It was going to be a $3 billion, took effect. It was going to be a $3 billion program. The same actuaries that the previous gentleman mentioned projected that 25 years later, in 1990, Medicare would be running at about a $10 billion clip annually. Well, in 1990, you know how much we spent on Medicare? $110 billion. So if you kind of just want a rule of thumb, whatever numbers you hear coming out of the CBO or the Government Accounting Office, just multiply them by a factor of 10, and you'll probably be in the ballpark of what the actual cost will be. As we have seen these big social engineering programs that the government attempts to operate, consistently operate at an exponential factor in terms of what was predicted, because there's no incentive to control costs. Mark Neerhoff mentioned Medicaid, and how we have, right now in Illinois, 1 in 5 Illinoisans are on Medicaid. A program that was set up to help the truly vulnerable, pregnant women, indigent children, individuals with developmental disabilities. It wasn't intended to be a middle-class entitlement, something that the political class could give away so as to create political fealty, because how you create political power, which is really what this all is all about, is by engendering dependency. When you expand freedom, a free people are not a dependent people, and thus they're not a reliable voting bloc. That's problematic for the Chicago Democrats who run the state and who we exported to run this country. So Medicaid, 1 in 5 now. As I understand it from Dr. Neerhoff, under Obamacare, with the lowering thresholds, we're talking about 1 in 3 Illinoisans are going to be on Medicaid. This is a real upside-down problem where you have the takers exceed the makers in raw numbers, and that is not a scalable model either. And it's interesting because Medicaid, Illinois is a good example because we've run it the way the federal government has run some of these other big social engineering programs, which is this. Everybody goes out to eat at a restaurant. You get a menu, there's no prices on it. Order whatever you want, and when the bill comes, it's based on ability to pay. So those with no ability to pay are going to order whatever they want because who cares? It's based on somebody else's ability to pay. That's how Medicaid is set up, which is why in Illinois, Medicaid is by far our largest single expenditure in general revenue funds. It's really bankrupting the state. I know we're spending a lot of time talking about public sector pensions and those unfunded liabilities, and that's very real too. But Medicaid is actually our biggest year-over-year expenditure, and last year, $3 billion in unpaid bills. And what happens, because we as a state say we're going to extend this benefit to hundreds of thousands of people, but we know we can't pay, so when providers come calling and we don't pay them, they stop accepting Medicaid patients. So now the very people that you were intending to serve have actually had reduced access to quality health care because you operate a system based on promises that you don't back up because this is structurally unsound and it's unsustainable. That's our Medicare system. By the way, how big is $3 billion? And this is just unpaid Medicaid bills in the state currently, before the implementation of Obamacare, which Pat Quinn wants to do post-haste. How big is $3 billion? If we fired all 60,000 state employees tomorrow, fired them, gone, everyone. You know how much money that would save? $3 billion. I'm not suggesting we fire all state employees, but I just want to give you order of magnitude of how much $3 billion is. Now, we could, on another topic, on another day, we could talk about the other $6 billion in unpaid bills that this state has currently that have nothing to do with Medicaid. This is what happens when you run systems that are based on generating political fealty, but run contrary to simple math. The other thing that's transformational about Obamacare was driven home to me last week on our show when we had the opportunity to interview Monsignor Reverend Michael Boland, who is the CEO of Catholic Charities Chicago. And he has filed suit, Catholic Charities has, as a bunch of other Catholic organizations and other enterprises of various faiths, now that the Supreme Court has ruled on First Amendment religious liberty grounds. And here's the reality. Dr. Neerhoff and Mr. Tucker told you in great specificity the reality of what Obamacare will mean in terms of your relationship with your doctor and the personal impact on you. Here's the personal impact of Obamacare in terms of your free expression of your faith. Reverend Boland was saying, so under Obamacare, I have to do things that we've never done, that I don't want to do. I'm essentially forced to intervene between a person and his faith to inquire, a la the Spanish Inquisition, what is your faith? I have to ask people who work for Catholic Charities if they're Catholic. I have to ask people who volunteer for Catholic Charities if they're Catholic. And I have to ask clients we serve in the myriad ways we serve individuals if they're Catholic. Because if I don't ask them and we end up serving non-Catholics, then I run afoul of the Obamacare exemption, and I will be mandated to do things, my organization will be, that run contrary to church doctrine, that run contrary to my personal beliefs, like providing coverage for abortifacients and birth control and the like. Reverend Boland said, here's what the administration doesn't understand. We've never asked that because we're in the business of serving people regardless of their faith. The reason we serve people is not because they're Catholic, it's because we're Catholic. You get the difference?
Yeah.
And so now, what do you have? One of the things that defines us as a nation, distinct from all others. One of the bases of the founding of this nation, as people freed religious persecution the world over to come here and start this country, you have people directed by the government to say, what's your faith system? I need to know before I help you. I need to know before I employ you. I need to know before I allow you to volunteer for my organization. That's something that is so much bigger than dollars and cents, bigger than the penalty I'll pay when I give up my health care and wait till I get sick, like Mr. Tucker was alluding to people will do because that's what makes rational economic sense under this regime. That is so much bigger. That goes to who we are as a people and the kind of society we're going to have. And that's really as fundamental to what's happening with Obamacare and this administration, the radical left, the desire, the demand that all loyalty and all prayer be directed towards Mother State, not towards on high. So what does that say about the impact of this legislation, of this regime, if it's going to fundamentally change our relationship with institutions of faith, their relationship with their parishioners or acolytes, and how we serve one another? Government always has to get in between. That's what it's about. And the impact on the state level is financial as well as spiritual and cultural. So it matters who our governor is. Because guess what? Some governors, Rick Perry in Texas, not so keen on implementing Obamacare, resistant. Some resistance would be useful in Illinois so that we stop being the bad example nationally. But it really frames the choice that we have in this election cycle 4 months to go, where everybody here has the opportunity to be an opinion leader, to move the vote in the same way that Tea Party candidates, grassroots conservatives moved the vote in 2010, so that you saw a lot of people who had actually voted for Obama in 2008 vote for conservative, policy-focused candidates in 2010. And we know that happened because we would have taken back the House, Republicans would have taken back the House had that not occurred. So the opportunity is to frame this election very similarly. Make it a referendum on Obamacare. Make it a referendum on your personal relationship with your God, a place that I think most Americans believe government should have no place. And it's the government-centric view of the world and the enterprise-centric view of the world. And which shall we choose? Are we going to allow, I should say, the government to tell us when we have to enter the stream of commerce, what we have to purchase, what we have to pay? Are we going to let them tell us who we can serve, how we can serve them, and when we can serve them? Those are some big questions that we have to answer that are transcendental questions for a free people founded on the God-given principles that are enshrined in our founding documents to answer in 4 short months. And we have to move numbers here. The good news is that outside of Chicago, Obama is running 15 points behind where he was in 2008. People, there's a lot of people that have been mugged by the reality of Chicago Democrat rule that may have never considered themselves Republicans, may not still. I don't care if they do or not. These questions that I just proffer transcend party affiliation and partisan label. But there's a great challenge and opportunity for people who know better, people who are hyper-engaged, like people who are here on a late Saturday afternoon thinking about these questions, wanting to get more information to disseminate, to control your vote. Educate within your circles of influence who care much more about what you have to say, who value your opinion much more over some politician whose name they may know but don't know that person, some guy blathering on the radio in Chicago who they don't know. They care about what you have to say because you're their friend. You have a trust relationship. It's your opportunity to control your vote and move that vote to the polls on November 6th. We remove the malignancy of Obama on November 6th. The nation goes under the knife. Thank you very much.